Hashimoto thyroiditis. Hashimoto thyroiditis is an autoimmune disease that affects the thyroid. The thyroid is a gland that sits right under the Adam's apple in the neck. It produces hormones and controls many functions of the body. Hashimoto's disease is also referred to as chronic lymphocytic thyroiditis and autoimmune thyroiditis. An estimated 20 million Americans have some kind of thyroid disorder. Up to 60% of those are unaware of their condition. Signs and symptoms of Hashimoto's are not unique. They are actually quite vague. The disease typically progresses over a few years, slowly causing chronic thyroid damage, leading to a drop in thyroid hormone levels. The symptoms experienced are usually those of hypothyroidism. These include fatigue, weight gain, cold intolerance, elevated cholesterol levels, depression, muscle aches, and joint stiffness, just to name a few. Signs and symptoms become gradually worse, and the thyroid becomes enlarged. So what causes Hashimoto's? Well, the immune system creates antibodies that damage the thyroid. Doctors don't know why the immune system attacks the thyroid. Some scientists think a virus or bacteria might trigger the response, while others believe that a genetic flaw may be involved. Hashimoto's is most common in middle-aged women and tends to run in families. If left untreated, Hashimoto thyroiditis can lead to a number of health problems. The first one is a goiter. This is an enlarged thyroid. Usually they are not uncomfortable, but large goiters can affect self-esteem and image and also can impede in swallowing and breathing. Heart problems. Heart problems can occur because of the increased cholesterol levels. It can also lead to an enlarged heart and, in rare cases, heart failure. Mixed edema is a rare life-threatening complication of long-term hypothyroidism that goes untreated. Mixed edema can lead to a coma, and this is a medical emergency. Mental health issues. Depression occurs early in Hashimoto's and becomes more severe over time if left untreated. Birth defects is the last medical complication. Babies born to mothers who have untreated hypothyroidism are more likely to have birth defects. They are more likely to have intellectual and developmental problems. Diagnosis and treatment of Hashimoto's is actually very simple. Diagnosis is made by a simple blood test. If symptoms are experienced, the doctor can order what's called a thyroid panel. This looks at the thyroid hormones in the blood. If the thyroid hormones are abnormal, then the diagnosis of hypothyroidism can be made. If the thyroid levels are normal and the patient is having symptoms of hypothyroidism, then the doctor can order one more test, which is called the thyroid antibody test. If that's positive, then the diagnosis of Hashimoto's is made. If both tests come back positive, then the patient has Hashimoto thyroiditis and has put them into hypothyroidism. Now, the most important thing is to educate the patients on taking their medications. The medication that patients take is called levothyroxine, also called Synthroid. It's a medication that you take in the morning on an empty stomach, and you have to take it every single day. There's no way around it. That's the lifelong treatment for Hashimoto's and hypothyroidism. So it's really important that those of us in the medical field educate our patients on the importance of diet, medication, and weight maintenance. Eating a well-balanced diet is very important since increased cholesterol levels are already a symptom. Patients have to be really careful on what they eat and try and stay away from high cholesterol foods. Medication is the most important thing to be diligent about. Taking the thyroid medicine every single day is the best way to keep them feeling better. Exercise will help with weight maintenance and help them feel better. Being hypothyroid makes it much harder to lose weight, especially those few pounds that you put on while the diagnosis was being made. So exercise and weight and eating right will help them lose that weight and help them to feel better. So the reason I decided to talk about Hashimoto thyroiditis is because I actually have it. It took about 3 years to get the diagnosis. Kept going to the doctor saying I don't feel right. Took 2 different endocrinologists to finally test me for Hashimoto's and immediately came back positive. So now I am into hypothyroidism, so I take Synthroid every day. It was frustrating to get the diagnosis. It took about 3 years, but I'm finally starting to feel better and losing the weight that I gained over those 3 years waiting for the diagnosis. So a diagnosis of Hashimoto's is not a death sentence. It's a chronic condition that needs to be maintained for the rest of the patient's life. It is important that we educate our patients on the importance of monitoring blood levels and taking medications. I know from experience that the diagnosis process is frustrating, but once the diagnosis is made, it's all about maintaining and feeling better. Thank you.